Warning signs: you're about to have a massive stroke. How to spot the signs. Sudden confusion and trouble speaking. You may know someone close to you, who by all appearances seemed in good health, and still suffered a stroke. But before we look at the warning signs, what is a stroke? A stroke occurs when a blood vessel that carries oxygen and nutrients to the brain is either blocked by a clot or bursts, or ruptures. When that happens, part of the brain cannot get the blood and oxygen it needs, so it and brain cells die, the American Stroke Association informs us. Sudden confusion and trouble speaking. Noticing the early signs of a stroke and getting medical help right away is key. If you or someone around you has a change in speech or appears suddenly confused, this may be a sign of a stroke. Many strokes are not associated with headache, but a sudden and severe headache can sometimes occur with some types of stroke per the Mayo Clinic. A stroke occurs when the blood supply to part of the brain is interrupted, depriving the brain of oxygen. It's important to recognize the warning signs of stroke, because prompt treatment can minimize brain damage. A numbness in the face can be a telltale sign of a stroke. Sudden dimness or loss of vision, particularly in one eye, can be another symptom of a stroke, per the Barnes Jewish Hospital. The majority of visual processing occurs in the occipital lobe, in the back of the brain. Most strokes affect one side of the brain. If the right occipital lobe is injured, the left field of vision in each eye may be affected. A stroke that affects the left occipital lobe may disturb the right field of vision in each eye, Virtua Health states. One sign of a stroke is a weakness on one side of the body, in the arm or the leg.